Okay, today I have a super exciting topic, especially for women with endometriosis that have persistent pain after wide excision surgery. So to start with, there's this catch-all term of irritable bowel syndrome, and it can be a diarrhea predominant or constipation. But regardless, and it seems that there's actually it's an umbrella for a group of diseases. Then I'm going to talk about this brand new study out that really answers, I think, some questions for probably a lot more people than we've known. So to start with, first I'm going to put up this diagram here, and we're going to talk about it. So you can see for irritable bowel syndrome, we have celiac disease, non-celiac, gluten sensitivity, nickel, allergic contact mucositis is the proper term. The FODMAPs, which stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And then there's SIBO, small intestinal bacterial overgrowth, lactose intolerance, and the ATIs, which is alpha amylase trypsin inhibitors. And that really is, you hear about how the gluten has become more irritable in the United States, and maybe some people in Europe can eat it. And it's really as they're developing this more refractory gluten, that it's resulting in an increased amount of this amylase trypsin inhibitors, and they're primarily resistant molecules contained in wheat or related cereals to fend off pests and parasites, but it makes it harder to digest. So those are that. And then this new study is looking at nickel sensitivity, and so you can have contact on the skin dermatitis, but this is mucositis. So basically the entire lining of the GI tract can become inflamed. And what they found, and it was a small study, they had a fair amount of patients that dropped out because they couldn't stick with the diet, but 28 out of the 31 patients, or 90% of patients with endometriosis, had this nickel allergy mucositis, and only 10% of non-endo patients had it. So super interesting. And so with nickel at high concentrations, it can be really inflammatory. The nickel-rich foods include tomatoes, cocoa, licorice, beans, mushrooms, broadleaf vegetables, whole wheat flour, soy, corn, onion, garlic, shellfish, nuts, canned foods, and tea. And then the other thing that really affects it is how much the foods are with the soil that has nickel in it, and processing a variety of different things. And then, so we talk about the GI symptoms, but the overall, so the GI symptoms: abdominal pain, swelling, diarrhea, constipation, ulcers, nausea, vomiting, and gastroesophageal reflux. And then they also saw that outside of the bowel, that the symptoms included respiratory symptoms such as rhinitis, kind of with your nose, asthma, headaches, your genital, including interstitial cystitis, vulvovaginitis, and other general disorders, including joint pain, chronic fatigue, and fibromyalgia. Any of that sound similar similar to what you guys are going through? And then it turns out we talk about xenoestrogens, or things in the environment that can act like estrogen. Turns out there's what they're defined as metalloestrogens, which include nickel, because it can bind with the estrogen receptors and stimulate them. So nickel. And then also I'll put up the nickel-containing foods, just a list of tables here. And again, the amount of nickel in foods, it can really vary a lot depending on the soil, the irrigation water, the plant species, fertilizers, and pesticides. So it just adds. And then I guess In this study, they also had people avoid using stainless steel utensils in cooking because evidently that increases the nickel levels also. And so in this test, they did a little patch underneath to see if people were allergic or not. This, let me see, so that, let me see. Oh, and so what they did is they put people on low nickel food diet, and over 3 months, significant improvement in both GI and overall systemic effects as well. And then the other interesting thing is we haven't really talked a lot about FODMAP, F-O-D-M-A-T, or MAP diet, but there's a lot of overlap between a low FODMAP and a low nickel diet. And so just super interesting. So it looks like, you know, if a lot of endo patients have nickel allergy, mucositis, and you have this, your gut's on fire, and who knows? I mean, a lot of these high nickel foods are actually, they seem healthy. So, so wanted to pass it on. Probably a big issue that we've not been aware of or known about. So anybody with GI symptoms, or even I'll put up a slide also with some of the systemic effects also, or overall, and we'll show that also. So if you have persistent pain, especially after wide excision surgery, and systemic symptoms, so the fatigue, you know, the chronic fibromyalgia kind of things as well, may be nickel related. So low FODMAP, low nickel diet, 3 months. I know it's tough, but give it a try. I bet it's going to make a big difference for a lot of people out there. So give it a try.